I'm Yvonne Martinez. Today I will be giving an informative speech about diabetes. Diabetes is a metabolic disease that affects many people from young to old. According to the American Diabetes, in 2012, 29.1 million Americans of the people population had diabetes. And according to the American Diabetes Association, the highest percentage of race ethnic background was the American Indians, Alaska Natives. Diabetes is when blood sugar levels in your body is high. The pancreas is what produces the insulin in our body, and that helps control the sugar in the body. When the pancreas stops producing or produces very little insulin, that's when we develop diabetes. There are several types of diabetes. There are two types of diabetes. Type 1 diabetes is known as juvenile diabetes, whereas the pancreas can't make enough insulin. And type 2 diabetes is where the pancreas makes insulin, but not enough to make it work properly in the body. Gestational diabetes only happens during pregnancy because the hormones from the placenta leads to buildup of sugar in the blood. There are risk factors that contribute to having diabetes. One is having a family history, being overweight, your race and ethnicity, and having had gestational diabetes. How is diabetes diagnosed? Symptoms of this disease can sometimes go unnoticed, and this often is diagnosed. Knowing your symptoms can help you prevent any complications. For example, hyperglycemia is known as high blood sugar level. Some of the symptoms will be frequent urination, extreme thirst and hunger, or hypoglycemia, which is a term known for low blood sugar, which symptoms could be pulling, clammy skin, dizziness, or disorientation. There are several tests to check your blood sugar, and one test is called the A1C. It's a test that can determine your blood sugar level for the past 2 to 3 months. There are blood sugars that can help diagnose diabetes, and there are random blood sugar levels, fasting blood sugar tests, or oral glucose tolerance tests. There are treatment options to prevent or treat diabetes. One of them would be lifestyle changes, which include diet and exercise. Others can control their glucose level by oral medications or insulin injections. One of the plant foods that can sometimes be used for treatment of diabetes includes cinnamon, which has been mentioned in the show for Dr. Oz, or in the internet article, Dr. Dan Singer states to follow your doctor's directions when you take insulin and other diabetic medications. You need to take some drugs with food to help reduce some side effects. Complications will include diabetic neuropathy, a type of nerve damage that can occur if you have diabetes. Diabetic nephropathy, kidney disease that results when you have diabetes, and cardiovascular disease such as high blood pressure, strokes, high cholesterol that can lead to a heart attack. Vision problems would be another complication, such as blurry vision, cataracts, and glaucoma. Diabetes is not contagious, but it is a growing metabolic disease that is only going to keep growing. Diabetes will continue to affect people if they don't start taking care of themselves. Diabetes is a chronic illness that requires continual care to reduce or prevent long-term complications. This isn't just about diabetes, but to bring awareness on how people to take care of themselves. Diabetes has affected my family. My mom is one of them. She has type 2 diabetes. And my sister, who developed gestational diabetes when she was pregnant. And I don't know if any of your family members have been affected by diabetes. Well, has this information been helpful to you so it can help your family?
Yes, it has. Very important.
One of the lifestyle changes would be, of course, to change your diet, exercise more. A lot of people here, especially in the border, were very obese. And I mean we because a lot of the majority are. And a lot of us require medical attention because it has come. As a nurse, I've come to treat patients that require dialysis from kidney failure, have had glaucoma from these complications, and that is all due to poor compliance in their medications, in their lifestyles. So, I mean, all this can help how to prevent or avoid any complications.
At what age can you get diabetes?
It can happen at any from young one, like I said, type 1 juvenile diabetes, which doesn't produce any insulin at all, or later on in life, which can be type 2 diabetes, which, because of the pancreas is not producing enough for the blood, enough insulin for the sugar to come. That's when we tend to.
If you get diabetes, do you have to check your blood? How often do you do it, or what do you do?
Once you've been diagnosed with diabetes, you're gonna get a machine called the AccuCheck. It's a glucometer, and you do AccuChecks. You perform them fasting, and there's a range. Sometimes the doctor will require a scale to see if you need insulin injections, or sometimes just by oral medications can be done. But checking your sugars daily can help you understand if you need to change somewhere along the line. Any other questions?
Thank you.
Thank you. I hope this class has been informative for you all and can be helpful for your family along the way.